Hello, everybody. Hope everybody's having a day in these hard times we're having right now. Just going live to update everyone in the how my recovery from meniscectomy is going. Meniscus, as doctors define, is repair, but the Latin ectomy actually means removal or excision. So the medical definition of meniscectomy is the excision of part of the meniscus uh, that needs to be removed or repaired. In my case, it was removal and cleaning out of meniscus tear. Just to update you, today's post-op day 49, and to update you why I haven't been on YouTube uh, is because I developed 2 weeks after my surgery Bell palsy. What Bell palsy is usually a paralysis of one side of the face, limiting movement, and giving you a pulling sensation. In my case, here, here. Uh, Actually, I felt like it was initially infection. So my doctor gave me antibiotic, but that didn't work. It got worse the next day, and I felt some pulling. My speech was off, and I looked in the mirror, and my smile was off. I initially thought possibly a stroke, but I walked fine, no limits in movement or anything like that. I called my doctor persistently 3 times, and he finally let me in the office. This was March 24th, and he said, "You have Bell's palsy, like a previous patient of mine from a week ago had." So now it's from the 24th, and there's a little movement blinking my left eye, as you can see, and my voice is a little bit better at times. Sometimes if I talk a lot, my speech gets slurred. So that's most likely the reason why I haven't been on YouTube and I haven't done any videos at all. Actually, this is my first live video that I'm doing. I'm going to update you. I go to physical therapy 3 days a week. It's a place called Professional Physical Therapy in Montclair, New Jersey. Still opened. Usually there's 3 or 4 patients there at a time, sometimes a little more, but we're spread out. Uh, the only contact I come up to is the physical therapist does a massage. Of course, wear a mask, both of us. And I'm doing on off days same exercises that I do there, the physical therapy on the table. But as such, I'm at home. I can't uh, do knee presses uh, at all because I'm not. So I try to do some light squats, even only 30 degrees wise. I do laying on the bed, leg raises, coming fully down and back up with the knee bent like that, and bent like that. I even have one of these gluten straps, which you can get on Amazon. They're not too expensive. And I rope that around, double loop it, onto my back of my knee, and I lay on the bed face down and lift the knee up and hold the rope for 10 seconds. Then I'll bring the leg down, then bend up for 10 seconds. I do 3 sets of 10 on that. Hopefully it helps the calves, glutes and quads. And then I do it the same leg, leg over the bed, hanging over the bed. I pull, and that works some of the same area, but the front wise. I do 3 sets of 10, and I even do down the left non-surgical leg, which also has a meniscus tear. I even do have a band, green band, which I'm going to show you. Put it up above my knee, and I get on the bed and have the leg stretch out and pump my body up, lower it down, and I do 3 sets of 10, and that works. You can feel it in the hip a bit, but most likely right now, I'm feeling my butt. And some of the other exercises I do, I don't feel it intense-wise. I'm still feeling slightly. I guess it's lack of strength. Got to be more intense-wise, I guess. I feel it more intently when I do physical therapy. Because as well, the therapist massages my knee, stretches it out by pulling on it to a certain extent. And I'm getting better. The mobility is quite good. Extension is good. The only thing really now is got to work on is strength. And not particularly on the bicycle, I've got to work on being able to stay on longer on the bicycle without any pain after 10 minutes, which I usually don't get. I try to do 10 minutes of bicycle right now. But that's the main things I'm doing. I'm trying to go for a walk, even at these limited times, walk around the block to get strength back in the leg and also more flexibility and agility. Hopefully, I'll be able to see my surgeon, Dr. Richard Rosa from Livingston, New Jersey, on May 15th. I was supposed to have an April 10th appointment, but from what's going on, they're going to protect themselves, understood, and protect the patients. So then, hopefully, I'll be able to go back to work, which I do valet parking, but still do part-time, and I got to watch myself. Because I got to go up and down stairs. Also in physical therapy, they're working on the stairs with me raising my right leg onto the stairs, and the left leg have be up like this, kick it up and down, back down with the right, up with the right, kick with the left, and down. Also, I'm working on balance by, I'll show you. I'm just raising my leg, the surgical leg, and standing on the left, and try to hold on for a minute. And I'm doing the same thing with the left leg, working on balance, which right now my right leg is shaking quite a bit, but it's lack of strength. But I'll get there. And as I said, this video is just short video to update you why I haven't been on YouTube, of which this is my first live video. I've done the others on using my cell phone, and it's just having patience, the work of God to heal me. And I also do some exercises for my eyes. This may help out somebody else who has Bell palsy. Just got to remain patient. Try to eat some ice if you're still having pain, which once in a while I do, but it's not waking up me in the morning as it used to. Try to do some exercises. There's 10 of each. And with the nose, 8, 9, 10. And work on a smile. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. And then I try to keep the eye patch on because it tears a lot. Those who are suffering from Bell's palsy know that their eye may tear. People who have minor case is that it may have affected drooping lip, drooping eye, one or another, or if you have the flow, it'll affect your lip, your eye, and you, when I said lips drooping, and it's hard to have mobility on food dissolving and chewing. As such, after I eat, after the gargle or clean it out, make sure you have a napkin and try to get the leftover food from that side back and then swallow. Try to eat soft food. I'm not going to attempt to even eat a hamburger. My wife ate some moist food. She's Philippine, so she cooked some good food and chicken. Once in a while, some soup. I need to eat protein and vegetables to keep up the strength and help the healing process. With surgery, I recommend those who've had the surgery make sure to eat protein, drink or vegetable meal, so it helps the healing and helps with getting over the swelling. Those few days of swelling, it swelled up significantly at times, and it's still a little swollen internally, which will take time to heal. And the scar is still there from where they put the scope in, which I believe it will remain. That's just part of surgery. And for those who've gone through the surgery, just to know some factors are make sure you have a pillow or some device to elevate the leg to help the swelling process. And if you're allowed, doctor said you're allowed to move the leg. If you just had meniscectomy like me, and make sure you do some slow movements so that you surgical knee doesn't stiffen up. And if you don't, it'll stiffen up significantly, even with doing some of the exercise, like leaving your legs stretched out, the left leg bent, and moving that surgical, like sliding into the bed, or if you have a device, and use the band and slide back out, slide back in and out. That will help significantly with helping to reduce the swelling and getting some movement back into that knee. And as I said, I have quite good mobility. I don't use a cane, or after a few days, I used a crutch just to help with the stability and all. And on the medication I was on for this Bell's Palsy, now which I'm off, and just remain patient, strong, knowing that physical therapy takes time with healing the surgical area, getting mobility, strength back, quite a bit of patience, and just hope you know uh, that if you're going through this alone, uh, just be persistent. Don't give up on your therapy, and don't give up on yourself. And for those that have a spouse or partner to help them, just encourage them to, which the beginning days and you can't really find yourself getting up easy, ask them for assistance for you to get up, or ask them to get you something like ice packs, significantly iodines for days or like a week. And then after that, I got up on my own. Even got back driving after 2 weeks, which my doctor said don't do 4 to 6 weeks. But I feel strong. I'm capable of doing it, and I'm not going to give up. Being patient, knowing that in the long term, I'll be fully capable of doing things I was doing before, and then do new things to get myself back, my whole body physically in shape, and have a good spirit with the assistance of God. I thank you for being patient with me. And to my new viewers, please hit the red subscribe button if you want to continue getting updates with more videos. And please thumbs up on this video and give me some comments in the comment box. But thank you. God bless you. Until next time.